We're going to pass to the neurology service, okay, of the 3A3 project that we have presented. The name of this project is increasing efficiency of the hospitalization process and decreasing length of stay. Again, we have the present of the A3 format. The background of this project is it's different of the last because 2019 we had a group of neurology service named Process of Early Discharge to the Neurology Service, and we achieved improvement in the average stay indicators, but the service continuously is review the benchmarking, and in this moment a service could see that the average stay is under the benchmarking. Okay, this situation plus the stroke incidence increasing at this moment. All this situation create a new necessity, a new need, and this service proposed us to continue with the improvement project and start with different goals. Okay, the service willing to continue improving these KPIs. Okay, we have the image important picture that you can see the gap is 1 day with the benchmarking. Okay. As a current situation, the group created again the value with other situation different to the last, with three main problems: poorly optimizing care times, waiting time transfer to other centers, and patient interruptions with the rehabilitation treatment. Okay, the main goal, it's the decreased average stay in 1 day, as you can see in the benchmarking diagram, in neurology service, patient in time by 8 months. Okay, the 5-wise analysis there. The main problem is the delay hospitalization, dividing 4 problems with different root cause. Okay, for example, I think that the most important root cause that we have is communication problems or communication circuit absence, a problem with the SAP, with the system, and the schedule of the rehabilitation unit. Okay. The countermeasures that we have implemented in this project is the check initial value stream map. In this case, is a review and a creation of a new one. The design and use the kata panel that currently we have this kata in the service, but we have the figure in the service that continue with the kata with periodicity without our figure. Okay, it's independent this service. The third countermeasure that we have is to organize the medical team and the ward. It's very important, the schedule of the head of the department, the different associate physicians, the optimization of circuit in magnetic resonance imaging and analytics. This it's a very complex point because the magnetic resonance imaging share the service with different problematic. Okay, and the last one is agreements with health centers and acute hospital to prioritize transfer. It's a problem related with the communication and coordination between centers. This is the action plan related directly with the countermeasures. Okay, all these actions are okay, are complete. Okay, and then is the very important point, the follow-up of this project, because we have 3 sample indicators: average stay. We have achieved decrease the average stay in 1 day. It's very important. Now we have a 10.02 days of average stay. Magnetic resonance imaging response time in 2 days. We have achieved a decrease in 3 days, and echocardiography response time we have a decrease of 2 days. okay? But the saving data is very important because now we have in average stay in the hospital in 8.2 days in the service. 1 day is equal to 520 euros. And the difference between years, between 2020 and 2019, is 1.1 days. It's more than 1 day. And the monetary indicator, the monetary saving, is 370,384 euros. Okay, it's in bed occupancy data, 157 beds per year. I think that is important because it's a saving. Other data that in the hospital is very important. Okay, so this is in summary this project that is a very big project, but I think that it's necessary to show all these indicators. Okay, I'm going to pass with Anna. Okay, that I'm going to explain the situation in Belviche.
Thank you, Jero. Okay, this is a picture of our hospital. The little one in the top part of the slide is the one of the panel that we have put because next year will be 50 years old, so it's a big celebration for us. Just to show you how big or how small we are, we are the primary care center of, primary care, no, proximity hospital for 200,000 people, but we are tertiary reference for more than 2 million people in the south of Catalonia. We are high technological hospital with all those beds, in normal beds, ICU beds, post-operative beds, critical cardiologic too, and we have 33 operating theaters and a lot of points to examine and to care for people, for our patients, and with more than 130 high technological equipment. Those figures with the asterisk is because of COVID pandemics that have made us grow. So we can achieve a better assistance for our patients. We have more than 5, but this is our top fields of excellence: health department, neuroscience department, oncological, transplants, and robotic surgery. But also we have 2 groups in the European Reference Network and in Spanish and in Catalan expertise units, and a lot of accreditations of excellence in other fields. So we are more or less 5,000 people working here every day in the hospital, and it's a big enterprise. So when we arrived here in 2016, we found the worst waiting list in Catalonia for surgical procedures, but not also for the surgical procedures. We had poor quality results, so we have had 3 different manager teams in 18 months, and with a very hierarchical organization that make really difficult to improve in the daily. So we have been in a deep economical crisis that here in Spain affect a lot in the public system of healthcare. We found that our professionals were really doubtful at everything and a little bit victimized because they thought that they couldn't change anything with this scenario that we had. So we had to improve our results, but also the way that people we are involved thought in that moment. We decided that we wanted to manage by processes. We make a research and find out that the lean methodology was proved that it worked in sanitary area, so in healthcare. So we were focused in efficiency as lean does, And we wanted to share and to collaborate with everybody and arrive to agreements so that people can work better and better together. It's a difficult thing to do sometimes. And first of all, and above all, we wanted to be respectful with patients, but also with professionals that had been really bad experienced in the last years. We had to start for something, and we had some criteria for prioritizing. First of all, those processes were related to the strategic plan of the hospital, or with the agreement we have with CatSalut that we renew every year. So we have to focus on that things that they are asking us to improve or to make new. We needed to increase activity because we had to clean that waiting list, and we detected a lot of dysfunctions, but not also from the management board, but also from professionals that wanted to improve the things they were doing every day. At the beginning, we started with the Lean team was just me, myself, and I. And I didn't have the knowledge. So we started with a consultancy service with a company that started with generating a culture in process management. That it was a good thing. It's in the list of pros. We started doing a process training. They prepare the way for change. I think that they make a good job in that. Empower professionals and achieved significant some changes in 40% of the processes they started, and they help us to detect some leaders in the teams. But also it had some cons. One it was that the members of the management were out of the process, and it's really difficult to manage a hospital if you are out of the process you want to improve. So it was a little bit strange way of work, but it was their way of work. They didn't have a clear objectives, probably because of that. We were, as managers, we were out of the process, and it was difficult to find out what was the objective for the team. And it was there was another con that it's important for us, that it's the lack of sustainability in the process they began, because when they leave, and they don't care if it goes on or it doesn't. So we tried to make our own model or our own team that we think that also has pros, also has cons. But it's for us, it's the one that is working right now. We can assure or promote this that the projects will go on and will keep on improving every day. It favors the culture of continuous improvement, because we are in the organization, and our mantra is continuous improvement, and we are always saying standardization and continuous improvement. It's evident that the managers are involved, because I am a part of the board management board. So it's a really easy communication between the bottom and the top, and we have a more strategic and global vision, because the part of the team is inside the management board. So we are linked with quality, patient safety, and technical secretariat, because it's part of my attributions as a manager. And the fact is that it's easier to implement decisions, because we don't have to pass for 3 committees to approve one decision. It's easier than that. But it has cons, because when we go with a team, when we go with a group of continuous improvement, sometimes it's difficult to keep us aside and not to try to implement or to impose your opinion. And it's also difficult not to take a lot of work to our offices and not delegate to them. We are a little bit paternalist in that way. Esto no es. ¿Qué ha pasado? Sorry. Sorry, I think it's okay. Ahora que nos falla esto. Bueno. Aquí. Sorry. We started when we in 4 hours areas of the hospital, but we have been growing with years and with the people in the team. So we started with 1 person, and now we are 4 people. So it's a big effort of the organization to implement Lean in our hospital. Now, even with COVID pandemic, we are having more or less 28 groups of continuous improvement. So we are really happy. And they are in those areas that it's almost 100% of a hospital. We have been working on the operation of room start time, in the sterilization, because we moved 3 surgical areas and 3 sterilization units to 1. And it's a big effort of efficiency. We have worked in the discharge before the 12 p.m. The average stay of some services, some circuits of preoperative tests in outpatient consultations. The things that we have been explaining before in the endoscopy department, tests without prior admission, 5S exercise, improving productivity, improving the recovery capacity, trying to reduce the rescheduling, that it was really important in this area. We've been working in laboratory, in the emergency room scan. We have now started, a few months ago, a big project in prosthesis logistics, that it's a big amount of money that we have to try to make more efficient, and first of all, the traceability of the prosthesis. We have done 2 little projects in human resources, our Lean office, and now we are in pharmacy too, trying to reduce rush orders that are confusing everything in pharmacy, and trying to dispense on time, that sometimes it's really difficult, and a big effort to organize the new pharmacy, that it's really big and full of boxes and full of things. So now in the emergency room, we had a first try of improved things. The manager that we had in that moment in the service wasn't really engaged in the project, but now with COVID pandemic and everything, we have shown that being flexible, thanks to our way of Lean thinking, it's a big thing. So they are engaged, and we are doing their Hoshin country right now. And then we participate too in the building and in the filling of elements of technological advices in the new, we call it Delta building, the new building for the COVID patients. So we did lean management in construction, and in the way we make our functional plan. In those years, we have been doing some Lean days. The first one in the 3 years ago, the second one, and now we have had last week our 3rd Lean day in the hospital. That has been a great success. More or less 1 year after starting with this trip in Lean management, we were worried about sustainability of everything we have done till that moment, because it was difficult to see how things go down again when we leave a place. So we started to research and to learn about Toyota Kata and to and Hoshinkanri too. So that's our strategy now. Now we are doing the Hoshinkanri of the whole organization, but we started before with some services, and maybe it's not the right way to start. Maybe we have started from top from top down, but we have started more or less bottom up. But it's it has been an experience too. We are doing three or four Hoshin right now, and now we have to fit them with the big Hoshin that we are doing in the hospital. The beginning was the neurologist Hoshin, as you heard before. We've been doing lots of projects in that area. They are really engaged with the methodology, and they are our defensors everywhere, our best managers. So then with the thoracic surgery, pneumology, and now we have the one in the emergency room that we are working on it. And this one is the one of the whole hospital that we are working on it with Uriol and with Institut Lin in Spain. And well, now we have to implicate everybody in this trip of lean management or of improvement. It's obviously that we have to engage people of the front line, but also the manager team, because if it's not implicated or involved, it's impossible to go on. We had a survey of professionals who participate in some of the projects 2 years ago, and the degree of satisfaction was really, really good. So we are really satisfied too, because we think that what we do is useful, but also well accepted for the teams and for the people who work with us. They said words like that the experience had been enriching, collaborative, innovative, illusional. Someone said, "Let's see if it works," because it's obviously that it's something that has to be proved. It worth the effort, satisfactory, positive, intense, surprising, because people think that everything has to go on like this because there's no way of changing, and they see how easy, or not so easy, but now how it can be changed. And this is our team, our dream team. He is Francisco, Rosa, yo, Ana, Jose, that is a nurse that is engaged with Lean too, with some specific projects in surgery area, and Jero, that is here with me. So that's our experience. I don't know if it's a good one for you, if you want to copy, if you want to copy what not to do, or if you have any questions that we can clarify.
Amazing work. Thank you very much for sharing. And we are only seeing the top of the iceberg of what is behind all this. A lot of work. The number of processes ongoing is incredible. I don't know how you are going to sustain it, but anyway, I would say good luck, because it's amazing what you are starting. You explained very the technical part of the projects you shared with us today, and we were wondering for you what is the biggest challenge you are facing relating to the social part of the projects. I mean, about people. What about people? How they are taking this?
At the beginning, it was difficult because it's something new, and they were, as I said before, under so many changes in the board of managers, and it was like, well, you are going to try to improve, but they won't let you because they will fire you in 1 year. So now we are here for 5.5 years, and I think that we have gain the confidence, and well, they know us since we were really young here in the hospital. We have been here till the end of the career, but now they see that what we want to do, we do it. No, it's not only words. So I think that now when we arrive to a service or to a unit and we say we would like to improve this, they receive us with a smile and with ganas, I don't know, wanting to work and wanting to improve their daily.
So the stability in the management team is crucial, you say, right? So the people.
For me, it's yeah. For me, it's a must, because if it's not a stability, maybe when will be another manager that it will be better. It could be, I don't know, but maybe he's not or she is not involved or interested in this kind of philosophy or whatever you want to say. But it's difficult to go on if the managers doesn't believe in the project. I have lost you.
So thank you very much.
Thank you.
We are more than 10 minutes after, but we promised 10 minutes more for the ones that are very interested in this model. As Cristina said, this is just the top of the iceberg. And just one recognition. Usually we see automotive as the leaders of the lean and improvement, and we always try to copy what industry, mainly automotive, like Toyota is doing. Now my recommendation is look for healthcare, because lean is about purpose, process, people, and in a hospital we have a lot of these three things: a lot of problems, purposes, a lot of processes, and a lot of people. Okay, that is about this. This is healthcare, and probably this is where lean is more advanced now. So my advice is, please take a look on healthcare. Well, we have just a last-minute question that I think that Cristina you wish to share with the.
So Jaime asked if, so now you see the question, you are now more efficient, but what about the patients? Are they better cared?
Well, it's a thing that it's really important for us that they feel better care. So in one way, it's I think that it's obviously because they don't have to wait so much time and they don't have to be subjected to a lot of non-value activities that now or well, that sometimes happens. But also we are involving patients in our processes. As Jero explained before, we have engaged some patients in making the value stream map, so they can say what is important for them and what is not. And we have also made some focus group with patients in order to know what are their highlights and their worries. So now it's like a natural evolution of our projects that we have to involve them or their opinion in different ways. So it's a good question and a good thing to have in mind, because we try to be always focused on them and not only in our way of work.
Great. Thank you very much. We are closing the session. See you soon. And thank you to all the people connected.
You.
Good job.
Thank you.
Nice to meet you. See you.
Bye-bye.
Bye-bye.